Any virus can infect heart muscle cell, influenza, cold viruses. Then, once they infect the heart muscle cells, there's an inflammatory reaction in the heart to clear the virus. And that is usually the part that causes damage to the heart muscle cells. We do know that the heart contains a receptor, the ACE2 receptor, that the COVID virus can bind to. We know in studies, autopsy studies of very sick patients, that approximately 50% of them have been shown to have virus in their hearts. We don't know how much direct infection of COVID is going to affect future cardiovascular disease. What we do know is with other viruses, for example, influenza, in years in which there's higher amounts of influenza, there are higher amounts of cardiovascular disease deaths in those years. So we know that anybody that has high blood pressure, diabetes with heart disease, has had artery disease, that those patients have twice the rate of death from COVID. We think that's because they have already inflammation and scar tissue in their heart that makes it harder to adapt to COVID, and they are more likely to be more inflammatory in the face of infection. And it could be that some patients have pre-existing disease that's been undiagnosed, and COVID unveils it. Obviously, any of the usual heart disease symptoms, if you have chest pain, go to the ER. And we are trying to emphasize this because we are afraid that many people have been avoiding the hospital for routine cardiovascular care. Patients that come in here with COVID are regularly checked for troponins, which is this heart muscle leakage enzyme. So very quickly we can tell if there's heart muscle damage in a patient with COVID. In addition, we've set up a protocol for doing what we call point of care ultrasound so that we can do cardiac ultrasound safely in COVID rooms and get certain views and understand if a person needs more advanced cardiac care. I think that what people should know is that we don't know if COVID is causing the heart disease or the heart disease was pre-existing COVID and it was just uncovered by COVID. So my message is how important it is for us to look at heart disease as a disease, look at prevention, exercise, eat your vegetables, go to your doctor, know your numbers, know your cholesterol, know your blood pressure, treat your diabetes. We are early in the disease, and science is the long game. So there is a lot of data coming out from the very sickest patients, but we still don't understand what happens in people with less severe disease. And it's going to take a lot of data collection, as we're doing at UW, and a lot of analysis and time before we know the answers to these questions. So don't panic, we're working on it, but don't expect a magical answer to what's going on for at least a year.